How do you know if you are deficient in iodine? That is the question we are going to dive into right now. I'm Dr. Michael Smith, a naturopathic physician in Missoula, Montana, and I work with a lot of patients that have thyroid conditions. Most commonly is hypothyroid or low thyroid levels. And in order to understand what iodine is, why we want it, why we care about it, and why we would test for it, we need to understand, kind of take a step back and understand what thyroid is in general. Thyroid is a gland right here in your neck. It is the source of thyroid hormones. And I like to use the analogy of thyroid hormones being like the individual on a steam locomotive. Go back a couple centuries, maybe not that far, and to the era of steam engines, and you would have a coal that would be helping power these steam engines. There would be an individual helping shovel that coal into the engine, and the faster that they shovel it in, the more coal is burned, and there is a limit, but you can think about it in the sense that the more coal that goes in the engine, the faster the train will run, the more heat, the more energy, things are going to be moving. The slower, the less coal goes into the engine, the slower things are going to get. And that's just like our bodies. Our thyroid hormone is that, in a way, that key to unlock our metabolism in our body. Metabolism is kind of, I like to think about it like the furnace in our body. That each cell produces energy, does things that help us stay alive, and we need thyroid hormone to kind of turn that on. And the more thyroid hormone we have, the faster things are going to run. The lower the amount of thyroid we have, it's going to decrease that. I like to use this diagram to kind of help us understand what's going on. So we have this axis of thyroid hormones. It starts with the hypothalamus. These are both in the brain. Pituitary is technically hanging right below the brain, but it still is connected enough that I'm classifying it in the brain section. The hypothalamus is in the brain. It secretes a hormone called thyroid releasing hormone, or TRH, to the pituitary gland. The pituitary gland then makes a hormone called TSH, or thyroid stimulating hormone. TSH is one of the most commonly tested thyroid lab levels there is, because if that is off, then most likely everything else is off below it. Not always the case, but generally that's true. The TSH then goes to the thyroid, as depicted by our little fellow here. The thyroid makes a hormone called T4, or thyroxine. And it's T4 because there are, I'll go over here, 4 iodine atoms on the molecule. And the T4 thyroxine, that comes in a bound format where it's bound to other proteins, and there's also an unbound version, or free version. Free meaning it can float around in the body. The free version is usually a very small percentage of the bound version, the total thyroid hormone. Thyroid T4 by itself can't do anything. It's not active, and what it needs to do is be converted into T3, which is right here. You'll notice that the difference between T4 and T3 is this little iodine right here. And there is an enzyme that helps convert T4 to T3 called deiodinase. Deiodinases the thyroid hormone, or takes off an iodine. Did I say D? Anyway, it takes off an iodine atom from the thyroid. Now, when the thyroid atom is taken off, it becomes T3 because there's 3 iodine atoms. When in that situation, the body is able to use it for doing that coal shoveling analogy, able to get power up the body, the cells, to do the machinery and things like that. It's kind of like the T4 is kind of like a delivery truck to the cells, but it needs to be converted into T3 for the things to work. So the key 3 is kind of like a key that unlocks the cellular machinery in the cell. So iodine is really important for the production of T4 in the body. And if we don't have enough iodine, that can lead to low thyroid levels. Because it's just like if you don't have enough flour, you're not going to be able to make enough cake or cookies or brownies or bread or whatever you're making with flour. It's an important ingredient. And so that's why we care about iodine. Iodine is a trace mineral. It's number 53 on the periodic table, in case you're curious. And iodine is really essential for the production of thyroid hormone. And there are many causes of low thyroid levels. We talked about hypothyroidism, hypo meaning low, thyroidism. And one of those causes is iodine deficiency. There are other causes, including autoimmune thyroiditis and things like that. But I'm going to focus today on iodine deficiency. And if someone is not getting enough iodine in their diet, then they will not be able to produce enough thyroid hormone. Now, in developed countries, iodine deficiency is not as common as it is in developing nations. Our food supply is more robust and includes iodized salt, which is where we get most of our iodine from. We can also get it from kelp and other sources as well. And we need that iodine to function. But for some reasons, right, whether it's a dietary deficiency or other things, we might not have enough iodine in our body. So it's really important to think about iodine deficiency, especially with people with goiter. Goiter is basically a swelling of the thyroid. And I've seen several individuals with goiters. Sometimes they're big, sometimes they're small, but it looks basically just like a little bit of a bump right around this area where the thyroid tissue has just swollen up a little bit. And one of the ways it can do that is through or because of iodine deficiency. So how can we test? There is a test for iodine deficiency. One way that we can do that is through just doing a blood draw in your arm, measuring the iodine in your blood. That is valid, but it doesn't really show us the functioning of the iodine, how it's working. The test that I like to do is a two-part urine test. So we have two samples where we collect a urine sample. And then right after we do that urine sample, we take a supplemental form of iodine. This is iodoral, and oftentimes we give 50 milligrams of this, so 4 tablets of the 12.5. And then we wait 24 hours and we collect urine with a 24-hour urine collection contraption. A portion of that is then used to fill out the second of these tubes. So we get 2 samples of urine, one before and one 24 hours later. And the difference between the two is the iodine. So what we can do is, well, the company does this, I don't do this, but the lab company will measure the amount of iodine that is excreted in the urine. And say the amount of iodine excreted is 60%. So that means that there was, of the 50 milligrams that we started with, 20 milligrams were absorbed by the thyroid. 30 grams were excreted in the urine. And when we can do that math, and if there is a lot of absorption, so if the percent excreted, I'm making sure I'm saying this right, if the percent excreted is very low, 5, 10, 20%, then you know that the thyroid is like starving for iodine, and it's going to absorb it. It will absorb all that iodine. And if it has enough that it needs, it's gonna release it. It's not gonna need it. It's gonna release it into the urine, and it's gonna get rid of it. And that's the beautiful thing about this test. Using 2 urine samples, a little bit of iodine, testing in between this loading test, we can really see if somebody is iodine deficient. And for me, that's a really important step as I work up many patients with iodine deficiency. It's important to know if it's iodine. If it is, that's easy. We can give supplemental iodine. We can work on salt. We can do kelp. There's lots of sources of iodine. We can work on that. But if there is enough, and iodine is not an issue, then we can cross that off the list and think about other things that are involved. And it's important, I think, to do that because we want to make sure that our bodies are getting enough iodine. And when we're looking up, helping somebody with low thyroid levels, we want to make sure that the iodine is not part of the picture, or if it is, we know that it is. So as we look at this hypothalamus pituitary thyroid axis, we want to know and make sure that we're thinking the right way about iodine. It's an important trace mineral that has profound implications. Thyroid controls every cell in our body. It helps regulate our metabolism. Too much iodine, too much thyroid can lead to just kind of everything moving too fast. I think for our bowels moving too fast, like more of a diarrhea type picture, our brain moving too fast, maybe more of an anxiety picture. On the other hand, just metabolism is greater. On the other hand, hypothyroidism, when there's not enough thyroid, that can lead to things slowing down, that constipation, depression, just things moving slow, weight gain, hair loss, a lot of those things that are symptoms that I see often. Interesting to think about. I hope you've learned something about iodine and the importance that it has in thyroid hormones. Thank you for joining me today. I will see you next time, and let me know what questions you have from me, a naturopathic doctor. Have a great day.